I'm Kendall Reed, the Dean of the College of Osteopathic Medicine at Des Moines University. Our interest in global health dates back several years. It's becoming increasingly important for our students that are entering any segment of healthcare to be involved in global medicine.
Yeah, it shouldn't be a decision. It should be done. It's a lot of fun. You're not going to have very many opportunities to do it in your life. This is one of those chances where it's set up for you, and I think you should grab it and run with it.
More and more our students demand that when they come to our university, and we want to be able to supply them with those opportunities, not only from the standpoint of what they're going to learn didactically, but more about the cultures.
To see, especially working in the AIDS clinic, the Hope Clinic, some disease states that we just, like I mentioned, don't see in the States. We've seen, my first day, I was able to see Kaposi sarcoma, even malaria, and things that I would not have been exposed to without being here and seeing it firsthand.
And the key thing, I think, that we have to address is not so much traveling to countries and putting Band-Aids on small populations, but looking at sustainable efforts that we can all address.
With specific to talk about South Africa, luckily with Dr. Blessman, your help, we have now developed good relationship. The students, this is our third batch of students, and the first batch and second batch, they had great clinical experience, a lot of cultural experience to learn about the country where for most, it was the first time.
The physicians and the nursing staff treat us as though we're actual physicians. I mean, the level of experience and responsibility they give us is as at the level of a physician. So we're able to write orders and order tests.
It's been a pleasure to host your students here in South Africa. All the students have been just wonderful. It's been wonderful having them. It's been wonderful for our institution. Our doctors have enjoyed interacting with them, and my office also has enjoyed interacting with them, including the administration staff in the hospital.
It's interesting how some of the most often questions we're asked are, how would you do this in the States? So it's kind of funny because as interested as we are in how they practice medicine, we kind of get the same feedback.
Yeah, I've had an opportunity to visit with our students since we've been here in South Africa over the last few days, and their enthusiasm for this project I just cannot overemphasize. I think that their ability to come back to the States with a whole new idea of what global health means, and particularly the country of South Africa, which is so beautiful and has so many rich opportunities for our students, we really appreciate that.
This agreement is going to help us to streamline our cooperation, especially with sending off the students to your institution overseas. And we think it's going to provide us with a wonderful opportunity. But the other leg that we're looking at is actually exchanging specialists, doctors in various fields, and we hope that this will help improve our academic standard, improve our service standards, and also research. We hope will cooperate widely on that front also.
Our students are very excited about the global health opportunities that we have. This is just one of many, but it is an opportunity to not only learn about how health care issues are dealt with in other parts of the world, but also to learn about the people and the culture and to have the rich experience that they have of coming here and visiting South Africa. So it's been a wonderful experience for the students, and we think for years to come it's going to be an enriching and great learning experience.
It's just really neat that they're very willing to give us the opportunity. I mean, we were first assist on all of the cases, and sometimes they'd even hand us the scalpel or the suture and let us go at it. So it's been a wonderful opportunity.
So what we're going to do here is to sign formal agreement with University of Limpopo and Des Moines University, so our students can come and rotate. Their student in future can come to Des Moines, and also we can do hopefully some research activities in common.
But when you pray, God answers prayers. And it happens so often here in Africa. When we pray, things happen. And it's our responsibility and our duty to gather together and just thank God. And certainly not every plan or action we take succeeds. But I think this week was a tremendous success.
I just feel my life is wealthier because of the new partnerships and friends that I've made in this trip. It was, quite frankly, a spur-of-the-moment decision. Jim and I had lunch one day, and he said, "We're doing this, and you ought to come." And I think 10 minutes later, I said, "I do have my passport current. I'll be on board."
Now here we sit looking out from the top of this mountain over what appears to be the entire country or continent of Africa right from here. And yet it's only a small little piece. And I think about those students too. And I think about their view now of medicine and the way they're going to see their careers from this point on as a result of being here. And I'm just, I was watching them throughout the weekend, and they were in awe. It was a pretty incredible experience.
If I look at the 5 students that were here, I kind of feel like their father in a way as their dean. But the joy that those young men had was truly amazing. And I thank you for that.